Подожди, пока туда поставь. Тут некуда уже.
Please mute your microphones when you enter.
Ой,
They cannot understand. I can do that. One moment.
It's recorded in the cloud, is it?
Yes, it is also with AI.
People are still popping in. I will wait 2 more minutes. Then we're 1 minute past. And then we can see. Mhm.
You can start, Claudia, maybe.
There's so many. Can you mute the people who are not? Okay, I'll ask
Yes,
them.
I am. Yeah.
Well, people are still popping in, but I slowly will start. First, I want to welcome all our LMHI members. Good morning, good afternoon, good evening, wherever you are all over the world. And for our Russian colleagues, our Russian NVP has organized the possibility of Russian interpretation.
Hello.
So if you haven't been told by now, you can...
कोचर फर्नीचर के आगे हम आ रहे हैं कोचर फर्नीचर के आगे आ रहे हैं 5 मिनट में आ जाएंगे.
Okay. Okay, do you hear me now? Okay, thank you, Vera, for explanation, or whoever explained. So who wants to hear Russian translation? It's possible if you click on interpretation in the list, in the line on the bottom, and you choose Russian. There's still a lot of people coming in. Maybe I wait a few more minutes until it's not so many joining. One thing I want to ask you, please, as we are many, please mute your microphones, because otherwise we have so many noises interfering. Please, all of you, mute your microphones. Still many people coming. Okay, now we're 2 minutes past 3. coming. Okay, introducing first myself. Whom do you see here? I'm Claudia Gahn, the Secretary of Education of LMHI. And I'm very happy that we got Gloria Feighelstein, Dr. Gloria Feighelstein, our Secretary for Dentistry in the LMHI, to hold this webinar today. She's very experienced. She's over 30 years in homeopathy and dentistry. So there's such a huge time and practice overlooking she will share with us today. Before saying a few words to Gloria, I want to welcome once again all the many others who have come in between. Good morning, good afternoon, good evening, wherever you are, all of our LMHI members all over the world, to our webinar today about a brief look at homeopathy in dentistry, held by Dr. Gloria Feighelstein. She's our Secretary of Dentistry of the LMHI and also in the LMHI board. She's a specialist in homeopathy. She's also a specialist in oral and maxillofacial surgery and traumatology. She's University Health Professor of Homeopathy, of Biology, Histology, Embryology, Pathology, and Clinical Biochemistry. And she's the Academic Director of the Brazilian Academy of Dentistry. So welcome, and I'm very happy that we have Gloria Feighelstein today and can listen to her. Just a few brief informations how to manage during the webinar. First, please, all of you, mute your microphones. When you have a question, please write it either into the chat or raise your hands. And the reactions, there is reactions in the bottom line. You can choose raising your hands. And we'll watch. If I see that a hand is raised, I will ask you to speak, or you write the question into the chat, and we'll watch the chat, and then we'll read your question. I think this is what I needed to say on organizational things. And please, Gloria, I hand over to you.
Okay. Hello, everybody. Good morning to the Americas and good afternoon and night to Europe, Africa, and Asia. I am very, very, very happy. Thank you, Claudia. It is a great opportunity to spread the homeopathy in dentistry to the world. I am seeing colleagues. I am seeing Gregory from France. Comment ça va, Gregory? All my friends from Russia, Tatiana and everybody here, and from Africa. I am glad. I'm very glad. Glad. I hope that you can keep this information and keep it with you and be very important for all of us. I don't know how many dentists have here, no mind, because it is important for all the homeopaths. It's important to the doctors, medical doctors, to dentists, to medical veterinaries too, and to the pharmacist who is going to prepare our remedies. So it's very important to all homeopaths. So, and I hope that I can give you the best. As Claudia said, I am Gloria, Secretariat for Dentistry at LMHI. I am a homeopath, graduated in 1992 from the medical course of homeopathy at the Hahnemann Institute of Brazil, where I created a specific course of homeopathy for dentistry. Does not exist this in 1992. From 1999, I joined LMHI, where I am today, and since then, giving lectures, seminars, courses around the world. There are more than 30 years dedicated to homeopathy. I hope that this knowledge acquired over the years will be useful to all homeopaths and those interested, very important, in homeopathy. They are not homeopaths yet, but they are interested to know our science that are present here. I am initially addressing the individualization of dental patients from my constitutional, preventive, and therapeutic view, mainly at the beginning of the bone and dental formation. And after, I will talk about an oral disease that affects many susceptible individuals, is the periodontal disease. I hope you agree. Now I am going to share. Okay, are you seeing everybody? It's okay? Okay. So this is the webinar of dentistry webinar promoted by the LMHI Secretariat for Education, Claudia Garnes. Let us begin. The homeopathic constitutions, very important. A dentist have not only to treat with the homeopathic remedy his patients. He must see who is this patient and treat mechanical too. So have no time. So when we begin to individualization the patients with the constitutions. So we are going to see the constitutions applied in dentistry. Okay. Oh, homeopathy has existed for more than 2 centuries through the observation of Samuel Hahnemann, having a fast scientific basis, a long history, and effectiveness with a strong social sedimentation through the world. Homeopathy has a very peculiar philosophical framework where the view of the individual as a whole, its curative and preventive functions stand out, and absolutely integrative view. I saw Florinda. I can give my congratulations to the webinar in France, please.
Thank you very much.
So Samuel Hahnemann, the homeopathy father. Everybody knows him, no? I have him here. I have him in my office to everywhere. So preventive action in the Constitution. That's very important, very, very important. But what is Constitution specifically? It is a human type study. It's like a relief printing, the result of which shows a set of characteristics that are person to each, based on the theory of constitutional types described by Nebel and Varnier, and referred to by Professor Ezayaga as genotypic constitutional types. Okay, what that's mean? So, constitution is the changing aspect that we find in each individual person, referring to this totality characteristic. We know that we look for the individual person. Constitution reports the heredity of each individual that has been, let me put this here, okay, with him since his birth. Therefore, it is totality characteristic of each. It is each personal signature. It is based largely on the structure and composition of the tissues and skeletal formation, better saying, each is each, and with their individual hereditary characteristics that are immutable. Individualization. They are normal. They are individual persons. The constitutions with their individual characteristics are known that and studied, being of great interest to the entire medical field. As I said, here we will address the morbid manifestations with great emphasis on tooth structure and some basic considerations necessary at the general level. So local and general level to arrive in the similium. Carbonic constitution. They are short, proportionate, individual, robust, heavy, predominance of adipose tissue. They present acute angle and legs, not like this, but like this. Ligament stiffness and sweating at head, feet, hands, and abdomen. Carbonics are organized, responsible, logical, precise, meticulous, methodical, decided, and resigned. Tired little, like eating in large quantities, adapt easily to the routine, and has need for safe things, safe work, safe jobs, must have safe things. They are conservative people. They wear simple and practical clothes. They follow long and safe professional careers, very fond of money. They are good savers, and they are terrified of becoming poor. They are rational, introverted, and socially respectful. And now, the dental carbonic constitution tooth. You see here, presents a short root with a wide endodontic canal, quadrangular crow, cervical, incisal diameter equal to distal mesial diameter. We are going to see more then. The phosphoric constitution. The phosphoric is an elegant, thin type, long linear, long limbs and narrow chest with their joints when stretched form a degree of 108 of angle. It is imaginative, emotional, creative, poetic, sociable, passionate, and capable to adapt easily to the most diverse situations. They like to eat frequently, and they are demanding with food, losing weight easily. They are hard to sleep they wake up later. They have a little physical resistance. Usually they are dedicated to the arts and humanitarian causes. Very elegant, with a lot of aesthetics. They don't like to get sick or like to strip naked in front of others. Our phosphorical dent constitution present to you the tooth. Is long hood. You see how one thing have with the other, the tooth is going together with the body constitution. So the root is a long root and is a narrow endodontic canal. It's very difficult to treat. Have a triangular crow, creator cervical incisal diameter to the distal mesial. It's like a triangle. And the fluoric constitution. The person in this constitution has variables tutor. Is the most important for the dentistry in homeopathy, but usually less than average. Flabby tissues. I am saying this now, but you are going to see this is specific to the tooth bend. So do not forget. Flabby tissues, musculature and elastic ligaments that allow extreme position and movements. Who is the dentist here knows and make orthopedia of maxillars is going to see how is the fluoric remedies going to help in the movements. Asymmetries and osteoconjunctive dystrophies, elastopathies. Imagine a professional from the Six of Soleil may present morphological change in size and number, microcephaly, polydactylia, supernumerary teeth, microdontia. He is an unstable individual. He wants balance, but he does not reach. He has an aged appearance, perhaps due to very little secretion, sweating very little, consequently decrease hydration. Has a predilection of fashionable clothes, brightly colored, eye-catching, but not very elegant sometimes. Sometimes is. Little modesty and exaggerated libido. He is an intuitive and quick person and explosive reactions, but does not hold any grievance, soon forgetting the annoyances. Look what I said. The fluoric is very important to the dentist. So presents a delacerate, or for the left or for the right, covered endodontical canal. Sometimes have branch from the main canal here that make like that here. Is very, very difficult to treat. So we know how the endodontic dentist doctor is going to know first which instrument he is going to treat the canal of this patient. Irregular crow with serrated incisal, irregular cervical incisal, and mesial-distal diameter. And the sulfuric is important too, but is the most normal that we have. Generally, they are medium, normal, neither fat nor thin, harmonious and balanced. Sulfuric biotype has a tendency to manifest congestive, that is important for us, spasmodic and suppurative of serous, mucus, and skin. So, eczemas, allergic manifestations, furúnculo abscesses, pulstic acne, hemorrhoid, arterial hypertension, and so on. Regarding predispositions, they can present in dentistry. Pulpar hyperemia is the beginning of the ache when something is happen with our tooth. Is the pulpal hyperemia, is the beginning. Acute pulpitis, affective and allergic stomatitis, acute inflammatory process, predisposition sulfuric to suppuration. So the sulfuric constitution have these predispositions. The importance of the constitution approaching is extremely important for the homeopathic dentist doctor, but not only for them. You are seeing that is for every homeopath. So now I am going to share another post. I put in all the languages I can understand here. Let me see. Oh, I want to share you something, please. Oh, wait. Here. Oh, this is Rio de Janeiro. It's to you to see my city in Brazil. Continues. Okay. Now we are going to see the constitutional homeopathic remedy in dental pediatrics procedures. Prevention is the most important. Here is our homeopathy where he can active very, very hard. Emotions alter endocrine system by increasing or decreasing saliva secretion, thus change oral acidity, what leads to enamel decay and cavities, the oral acidity. So cavities may be seen as a social psychosomatic evidence. If individual is susceptible and not only as physical evidence, that is the homeopathy interpretation. Men, homeopathy treatment, therapeutic has a constitution medicine view. Carbonic, phosphoric, and what are you? Oh, fluoric. This is the three main constitutions in the homeopathy dentistry. Now, here is in Portuguese. I put here in English to you to understand. If you don't, please tell me, then I will explain the best I can. The carbonic, the occlusion, is renamed in dentistry, angle class 1, 2, and 3. Here is a carbonic. The carbonic, as we know, have class 1 of angle. He bites the superior arcade direct to the inferior arcade. I want to be near you to show it, but webinar, we cannot. So, and have the wider dental arc. Here, everybody have his place. But you know what happened? When he bites too much here, it disgusts the enamel, you know, because he bites like that. So we'll not have problems with the place of the tooth, but we'll have problem with the disgust of the tooth. The phosphorical is the class 3 normal, the class 3 of angle, is a prognative. The narrow, the dental arc is narrow, narrow, and long. Narrow and long. The fluoric, as I said, the ligaments are here, and is like a train going from Vienna to, oh, sorry, to Hungary. Look, here is the train. Choo, 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 choo. So the flexibility of the ligaments, and is a class 2 of angle. Class 2 angle. Retrognatismo. Calcária carbônica. The median gamut of the calcária. General characteristic, essential conflicts of neurosis, anguish, emotional disturbance persistent, sedentary lifestyle, and habits inadequate diet and hygiene. Calcária carbônica have a slow and problematic eruption. Pediatrics, odontopediatrics, the babies begins the tooth begins to appear, eruption, and in the carbonic, they are very slow and problematic. We are going to see it more then. Early cavities by cervical region. Let me see here. You can see the neck of the tooth.
Вот вперед.
Early cavities by cervical region, periodontopathies do exaggerated carbohydrate injections and poor oral hygiene, recurrent herpes here, and stomatitis, acute abscess and oral infections. Crow shape is quadrangular. We saw it before. Color, we don't saw. I'm saying now, is opaque white. The phosphorica, calcária phosphorica, have this general characteristic. The child calcária phosphorica, it is a long, but not very developed. During breastfeeding, the child has a great length and characteristic thinness. He's a smart, precious baby, agitated, nervous, and crying a lot. It is sensitive to damp cold, and when there is change of weather, the doctors know that, the allergic doctors know that the child has fever, and the mothers too has fever and bronchitis. The calcária phosphorica, teeth calcification is problematic. We need give to the babies, to the children, calcária phosphorica with 6 months of life. From 6 to all the teeth are in the mouth. Delayed epiphysis evolution along with painful joint during the growing phase. You know that epiphysis in the leg, the child said, oh, it's aching too much and have nothing. Or maybe it's a phosphoric. The epiphysis evaluation shows a painful joint during all the growing phase, and the tooth also. It is recommended during the first months when mineralization is in progress. In Brazil, I will tell you with our experience, we begin to give the calcareous as a prevention to the mother. I didn't put here because it's going too much to speak. I am speaking, but we give the calcareous to the mother. We see the constitution of the father and the mother, and make a homeopathic remedy of calcária, or fosfórica, ou carbônica, ou sulfúrica, ou fosfórica, ou fluórica, to the mother. And we begins the prevention since the beginning because the teeth begin to grow, to be making inside of the jaw of the baby inside. So we begin to give in Brazil to the mother. So one day I will talk about this and explain to you. So slow and difficult, painful dentage, a long and fetid and abundant diarrhea, early to occlusive cavities. These cavities is right after the teeth eruption. Hemorrhagic gingivitis do peripheral venous congestion, bentoneuralgia, cavities with high sensitive to cold. And here is. Begin to eruption, the tissue get out, the tooth eruption, and appears with this decay. Now the fluorica. In Brazil is the most important in the public health, in our system, and Swiss, unified health system. Calcária fluórica. The individual has a disordered gait, abstractions and creative imaginations. They are indecisive and anxious, but versatile and unpredictable. They can't stand contrarios or discipline. Do not do this. Don't contrarios a calcária fluórica. It is an excellent homeopathic remedy in public health due to its selective action on dental enamel and bones. It's very, very important, the most important for us. Each country is each country too. May show morphological alterations in size and number. Calcium fluoride is found in bones, enamel, elastic fibers of conjunctive, vascular tissue, skin, glands, and neural tissues. Whenever a deficiency is present, those tissues are going to be affected. The dental disorders, small and gray. You see, the calcária carbônica was white, opaque white. The calcária fosfórica is yellow, the color. And normally, you can, could be normally, but sometimes it's not. I am saying this because you do not look for gray, opaque, and yellow. No, so it's normally gray, the fluorica, the colored teeth. They are small. sometimes opaque, like here. Friable and corrugate enamel. Lateral incisors very, very small. Outnumbered dentary. You see one other and one in the middle. Mesial teeth and agenesis, no tooth. Anadontia, we said. The fluoric is the most important. Other dental disorders, early cavities in proximal face, gray, early caries. Tooth mobility due to hyperflexibility of periodont ligaments. It's very difficult to treat orthopedically these patients. Pulp disorder, do you remember the laceration of the root? Followed by fistula. Here is. This is the calcária fluorica and more. Periodontopathies due to bad positions. Alveolar and maxillary anomalies. Look, the train. Hyperelasticity of the ligaments. Alveoli are fragile and thin at the level battery. Attention. Be attention, my dears homeopaths, attention. Calcária fluorica patient is more sensitive to fluorine and may present pathogenesis due continuous use of it. For example, the fluorosis. You see, we have fluor in the paste, dental paste, to brush the teeth. Oh, we fluor, so we put there. We have fluor in the water. We have, that's enough, do not necessarily the others. We have fluor in the, if you, a resin that you put in the K and in a cavity is with fluor. You are going to make anything in your mouth, in your teeth, have fluor. Base cell with fluor, and with fluor is more expensive. So take care. The continuous use of it, like example, is going to make a pathogenesis in a person, calcária fluorica. Okay. Tooth eruption disorders go beyond the oral and dental aspect and place the child in a new phase of life, where new sensations and contacts with the world begin to happen. And the power to bite promotes a new attitude of life. You see, when the baby teeth erupts, the child stops sucking the breath of his mother and starts to bite and have necessity to bite. So his life changed. During the eruption of baby teeth, normally preceded by a lot of saliva, functional changes associated with general disorders are resisted, where the homeopathy exerts its effectiveness, relieving the suffering of the children, parents, and grandparents. You see that when have a diarrhea or something like that, too much saliva, And they went to a normal doctor, pediatric doctor, and the pediatric doctors prescribe a lot of conventional remedies, not necessary to the children. We can treat them without any of these, nothing of these remedies. It's very easy. In the pharmacies, you see a lot of this. The homeopathic pediatric dentist doctor, of course, observes, monitors, and guides in the best choice of the appropriate homeopathic medicine for each case. When disorders arising during the eruption of children's teeth, a lot of saliva, insomnia, fever, sometimes convulsions, diarrhea, emotional change. So we got and can do it with the doctors, medical doctors together. Very, very, very nice and very good for our patients, for our babies. And more. This is very important to the mothers and to the grandmothers too. A child who was not breastfed use a pacifier of fingers for a significant amount of time will feature lack of interoral space, atypical swallowing, adenoid hypertrophy, constant run nose will be a mouth respirator. First step, we must put the teeth in their place. Direct physical action of the homeopathic dentist, because only the homeopathic dentist will understand all of these. Functional jaw orthopedics, objective to enable the emergence of the patient's authentic personality before impossible to be expressed then. The second step, like together, correct use of homeopathic remedy. Profession interrelationship. Whenever possible, maintain interrelationships between homeopathic professions, dentists, and in this case, medical doctors. If we work together, our patient will receive the best treatment and will obtain the best result. Let me tell you something. Is that why I am, first of all, I have medical formation, then I went to the dentistry. And I want to say you something. Is that why I work for 30 years? I put the dentist course in Brazil and in the Liga too, and because it's very important to the medical doctors that have homeopathic dentist doctors. Because if you stay with your patient 2 hours to see his remedy, work to materia médica, work to repertório, make all the work we do with each person, and these patients go to the dentist, and the dentist arrive there with camphor and take an X-ray and something like that. Wow! They are going to move with our energy. All the work we are doing, we are going to lose. So it's very, I said to you that is very, very important that we have in mind that we must have so many homeopathic dentists in the world to go with us. Look, I put here for this constitution, here's a place, is the San Francisco, is the river that have in the northeast of Brazil, and here is where I live. I am now. I am now here in Aracaju. My house is quite in front of this beach, and here's a place near house too that we go sometimes to rest. So thank you, vielen Dank, muchas gracias, bon spasibo for you. Let me go to the other.
We didn't have any question by now. Are there any
Yes,
questions?
if you have, yes.
If you have any questions, you can either raise your hand or write into the chat, please. Write in the chat you have a question, or raise your hand and we give you the possibility to speak. So no questions. Please, Gloria.
I have a question.
Aha, yes, please.
Please put your hands if you are understanding or enjoying all of this.
Yeah, we can.
Yes? Okay. Okay, but if you have if you have any question,
we have a question. We have a question in the chat.
Ah, yeah. This is a Russian question, so please, maybe the Russian interpreter, can you say it to Gloria so that needs the translation and back?
Leonid. Have a question? Can I begin the other, Claudia?
Did they ask you the question?
No.
Or there's something in the chat?
Who is sending me a question? I need to translate this for me.
No, Vera is translating
about-
right now.
The
in
Russian
the chat.
translation. The Russian translation. Okay, so it was done, I think, because she wrote in Russian that they have to choose in the bottom line. Okay.
Oh, heaven. Okay. It is about how to find Russian translation. Oh,
No, there was one now.
how to have
How to help with implantation.
Yes,
Yes.
she said.
Let me let me answer this first. Implantation is a surgery. The homeopathy is all in the surgeries, the oral surgeries. I am an oral surgeon, and I only treat with homeopathic remedies. So what we must do the implantation is not from this this webinar. I can give you in the other webinar when I will speak of the pre, trans, and post-operative in dentistry, in homeopathy in dentistry. So we must the bone, the cicatrization of the bone, the ache. We must see the blood. We must see the ligaments. And the calcária is wonderful for the cicatrization the bone. The calcária fosfórica is something very, very, very special, together with the Symphytum officinalis. I must talk more about this.
Yes.
Okay, Claudia. Also,
there's one more question.
two more.
The first I see is, first I thank you, Gloria, because it's beautifully described. But the question is, do you give these constitutional remedies as tissue salts during development, or which potency do you use?
To tissue salts?
No, the tissue salts, it's Schüssler salts. Or do you use homeopathic? Actually, Schüssler salts are not really homeopathic remedies. It's a kind
Yes, I give. Let me tell you something. I told that we normally begins with the gestation of the patient, the mother, and then the child in the pediatric dentistry office. How we do it? appointment, let me see, when the child arrives in our office. And it's beginning. We are going to make the individualization, the constitutional individualization of our child. So with this, we are going to see which calcarea to prevention, now prevention, it's not the problem here. We are going to prevent the problem. So we are going to choose the calcarea to these patients. I work in an integrated clinic in universities because in Brazil we have formation of homeopathy in the universities. Homeopathy comes with the curriculum of the universities of medicine, dentistry, medicine, veterinary, and pharmacy. So in the clinic, integrated clinic, we have no time because it's too much children. So we passed the 3 calcareas. We passed the phosphoric because we saw with studies that these trees are very important for us. Fluorica, phosphorica, and carbonica, like a complex, in 6CH, is that we use in the integrated clinics. But in our office, we can individualize better our patients and give the constitutional remedy to this patient. Did I answer your question?
Yes, I think it was what potencies. The question was also what potency of calcarea remedies you give to mothers and how frequently, how often?
The same, maybe. Oh, let me tell you something. You have the mother phosphoric and the father carbonic. Yeah, so it's a carbophosphoric person. The both is going to a carbophosphoric signs. So what we do, we see the mouth of the mother, the teeth of the mother and the father, and see what is the predomination of these calcareas, phosphorica, fluorica, sulfúrica, or carbonica. And we choose a remedy and give to the mother normally at the same six potency, in the same potency, 6CH, we give to the mother. How we give it? You can ask me how we give it. Only once in the day. Only once in the day. And when the baby was born, because begin at the 6 months inside the mother, begins the development of the tooth. So we begin at the 6 months of pregnancy, since the baby was born. Then we continues until the eruptions of the teeth. So we are going to see who is the babe. If it is really a carbonic, really a fluoric, really a phosphoric. The people will stay with us, with the homeopathic dentist for a long time. Begins when the beginning of the development of the teeth, continues with the mother and father, and then continues with the baby in pediatrics. We continue and prevent all of these decays, all of these problems, tooth problems that you saw it. Is the most important of homeopathy, the prevention. So if you can do it, we are doing this a long time. So if you can do it and have a positive return, it's very important for us.
Okay.
Because, okay? What is the other, please?
Yeah, I would like to specify more. So if you have a mother that you treat as a dentist, and you know she is, let's say, calcarea carbonica type, then you give it to her because you think the baby will have calcarea carbonica symptoms. Is that right? Or
Claudia, let me tell you something. you like as a homeopath, you must see the mother and the father, not only the mother. No, so you must see the mouth of the mother and the mouth of the father. You must see what is the predominance of the calcareous we have. Maybe the mother that is phosphoric have more predominance of phosphoric constitution than the father. No, so you can give the both the calcária phosphoric and the calcária carbônica. As I said, in the both calcareous, you can give it as a complex for the mother, for the mother, for the mother, until the baby was born. When born the baby, you begin to, you are going to wait and see the eruptions of the teeth, and see which one, who is the baby, the individualization of the baby. It's going to be one or other, and sometimes the grandmother, but the mother and father. And we have this, and it's very good. We have absolutely very, very good results. Very, very good. Well, they don't leave me.
But when you give it as a complex, you mean you give, I don't know, 2 globules of calcárea fluorica?
One globule is sufficient. And
One
see,
globule. And one
maybe
globule for
one drop.
calcárea fluorica and one calcárea carbonica, both
Yes,
together.
or one drop with a spoon with some water. One drop is enough for this. Enough. So we have custom to prescribe 3 globules for everybody. Please put 3 globules in the mouth. It's not necessary. One globule is going, one drop is nice. It's not necessary too much, you know.
Okay.
And another thing, we have I don't know in Europe, but we have drops. In Brazil, we have drops, globules, and
tablets. Is it
yes,
tablet? The
tablets,
milk sugar one.
the tablets. Tablets, lactose, globulus, saccharose, and the drops have also glucose because you have alcohol. No, so no mind if someone is thinking, oh, it's going to have a decay because I'm given one. Please, it's not enough to have any decay. You can give it. No,
Okay.
no
There's
problem.
one more question. When someone's got a constitution of calcárea fluorica, if you make a difference, the diagnosis to silica.
If necessary, because if you give a calcária fluorica, the calcária fluorica is going to absorb all the problems that we have. You can give, how I give silica. Someone here asked me the implantation. I use the calcária, in this case, calcária fosfórica, symptom, and finalize with a silica sometimes, if necessary, but in high potency.
How high?
So you must be very, very, have a lot of experience to make this together, you know? You must have experience. You must see if it's necessary or not. Okay, it's not good to give the both together. No, you give calcária fluorica and let it. One drop, one globule, one tablet, and let it is going to be fantastic.
Okay, and then let's check whether there's another question. There was somebody asked, I don't know whether this is on your plan, about gum recession, if there is a remedy typical for gum recession.
May I go to the other?
Well, I think, what was else there? Let me read. Dermatophilia specialists are trained in Russia, India, and Brazil. a joint investigation of the constitutional character.
Oh, I have more here.
Carried
Oh,
out.
Sérgio, how are you, Sérgio?
Um,
How are you, Sérgio? Great friend.
okay.
Actually,
Is
in
somebody,
Russia-
Sergio, yeah. You want to speak
Yes,
because he says Russia, India, and Brazil is training dermatophilia.
yes, we can do it.
Okay.
We are going to talk in Spain.
Okay. Yes, in let's
Yes,
say in
he's the
Sevilla. And then-
MVP. Sergio is the MVP for Chile. We are going to talk about this in
Sevilla.
Spain. I see you. Yes.
Okay, let's talk about that. Did you want to say something to the gum recession question? To the gum moving back? Gloria?
Yes, please.
The
What?
question was the gum recession, when the gum's going back. If there's
The
a
gum,
special
the gum
remedy.
section with Vera, let me tell you something. Vera is the translate from my friends from Russian. So let me tell you something. I am going to talk about this in few minutes. I'm going to talk about the
5 minutes.
periodont resection, the gum resection, and say to my friend that I suppose that we are going to answer that question properly.
Great answer. Thank you very much. Please be patient. Okay, so thank you, Gloria. Let's move to the other one.
Okay.
Yeah. Mhm.
That's okay?
Yes, it's okay. Please move on.
Okay, thank you. Okay. You see, now we are going to speak about the periodont disease in homeopathic view. Another very important talk to you. Okay. What we must clinic observe? Insertion, alveolar cement and bone. Protection, the gums. Susceptibility to periodontal disease. This for me is the most important, the susceptibility. More, analysis of each case. When to prescribe, what to treat, which medicines to treat. Important, detailed history of the case. The patient with unexplained advanced periodontal disease who does not respond to conventional treatment may be suffering from mild immune deficiency. A detailed history is taken to discover which remedy applies to his phenotype. The aim of this remedy is to give his holy body a quick start to revitalize his immune response. Is that the energy we are giving our homeopathic remedy? A quick start. Acute process. Well, do you think that the patients goes like smiling? Hello, I am going to the dentist today. No. And more, you think that is the mouth that go walking to the dentist? No. Behind the mouth, we have a person with their anguish, fears, anxieties. You know, a dentist is a dentist. Oh. So we have a person with acute process. What homeopathic must do? Relief of the pain, control of the infection, prevention to the recurrence. You see? Pain. Here, a fistula, pain, an abscess, infections. Listen, the constitutional remedies. I said that I'm going to speak about it. Now we are. In addition to the conventional therapies of oral hygiene instructions, we must teach, we must show to our patients how they must do the oral hygiene. No, it's very important. The scaling, root planing and periodont surgery. Different constitutional remedies may be used for different patients with the same advanced periodontal disease. Let's see as examples. Toya, the intransigent brunette. Cilicia, the pale, retiring, hard-working wife. Pulsativa, the pale, blue-eyed, shy blonde. Fósforo, the tall, fiery, red hair. It's not fiery, it's fired. The dynamic balance rupture. This is important. Together with the periodontal disease, what happens? The dynamic balance rupture is the falling down of the organic defense mechanism in front of body injuries or microorganisms. These we are susceptible by the kind of injury in each individual field. This is very important. The clinical dental treatment consists of course, oral hygiene instructions, the biofilm control, the calculus removing, the orthodontic movements. Don't forget the calcareofluorica. Remember, I will make a test in the end of the webinar. Huh? Look, here's the biofilm, the control of biofilm. You think when you brush your teeth that you took out all the things, but if you go to the dentist's office, you are going to see when he put this thing terrible in our mouth that we do not did the work well. And this is going to give us the decay. And the most important, look here, how beautiful. The periodontal balance harmony is that we wish. The local treatment together with the homeopathic treatment will afford a periodontal balance harmony. The periodontal pocket could persist, but without degenerate reactions or without inflammatory disease, and sometimes without any surgical procedures. Look here. Oh, you can see that have biofilm here. If I put that colors, that product here is shown. But you can see that the pocket here is here, but the gum is okay. He must only brush the teeth. Look at the other side. The pocket here between one tooth and other tooth is okay. Nothing in the gums. Here, had sometimes something here that lose the bone here and the ligaments of this tooth here. But with homeopathic remedy, if you can see the X-ray, is begin to grow the bone again here, and no infections. And the gum outside is okay. This case, you see here, this person, this individual person have a susceptible to have periodontal disease, but he treated with homeopathy. And you see, he lost bone, the teeth are here, the roots are appearing, but no problems with the gums. He will continue with the his teeth for more and more time. You must treat with the homeopathic remedy. You see, if you treat with them, oh, sorry, let me finish. We can do it very easy and have very good returns. Periodontals, chronic disease. Classification in a homeopathic view. We treat recurring ulcer patients constitutionally as outbreaks, an acute manifestation of a more chronic disturbance. An acute prescription may help in this particular instance, but it will recur if the underlying chronic terrain had not been addressed. We know that. So, we must see, again, the episodic disease. They come from emotional disturbance, anguish, sedentary way of life, carbonic, stress, neurasthenia, bad oral hygiene, high carbohydrates diet, low organic reactivity, in the gums tissue toxins exoneration. Episodic oral signs, chronic marginal gingivitis, tooth cavities, the case, herpes, abscess, acute inflammation, stomatitis or ulcer, sores, gingivitis, look. Let me put here. Periodontal episodic disease, homeopathic remedies. Have more. I put the men that we use normally. Sulfur, phosphorus, silícia, arsênico com álbum. Very good. Pisorino, calcária carbônica. Psychotic disease. Blenorrhea, nasopharyngeal infections, chemical agents, vaccination disturbance, mechanical injuries, hydric retention. These we have vaccination disturbance, we are having a lot. We know why. Psychosis oral sign, supragingival cálculos, subacute chronic mucus pus secretion, dental mobility, periodontal pockets, hypertrophic gums. Hello, from who asked me the recess of the gums? Retract gums, polypus, gingival proliferation. This due for epileptic receiving gelatine therapy sometimes. We have very beautiful cases about this. The gingival proliferation due to the gelatine therapies. We do We have works about this. Periodontal psychotic disease, homeopathic remedies. Oh, some of them, very important. Natrium sulfúrico, medorrhinum, inaciamara, laquese, tuia, nitric acid. And now, psora, psychose, sífilis. The syphilis disease, osteoporosis, necrosis, degeneration, sclerosis. The syphilis oral signs. Acute necrosis gingivitis. Periodontal infections, ulcers, lesions, ulcers lesions, hemorrhagics with dental mobility and necrosis tissues. I am going to show you one. Periodontitis, gingival fiber rupture, periodontal pockets, bone resorption around the teeth. Is very important in diabetic patients. We saw it too much. Indentum eruption, advanced and postponed. Multicavity lesions, second and third grade in occlusion and interproximal surface in rapidly occurrence. We saw it in fluoric. Periodontal ligament is lacking with a symptoms dental mobility. The tooth have no decay, no cavity, but the tooth got out from the mouth because this lacking the ligament, the periodontal ligament is lacking in no symptoms mobility. Look, this is the acute necrosis ulcerative gingivitis. We must treat it first, then give the homeopathic remedy. Treat it as soon as possible. Periodontal syphilis disease, homeopathic remedies. Oh, the mercúrios. Have others, mercúrios solubles, mercúrios corrosivos, calcária fluórica e Staphysagra. Homeopathic remedies in periodontal disease. I want to say something. I put this yesterday night. I was thinking about, and I must put an observation in this slide. We must always observe the patient's vitality when we are prescribing. Maybe a children, a elderly, adult, an adolescent, we must see the vitality of the patients to prescribe. Important to know that we are prescribing, in these cases, at local and general level. We must do it to then go to the whole remedy of the patient. In this case here, if you see, let me tell you here, we must treat in local and in general this patient. Then we're going to look for his remedy, old remedy. So, arsenical album, anxiety remedy. The anxiety in arsenical patient is a little bit different from the aconitum napellus. The arsenicum have chronic anxiety. They worry about a lot of things, especially their health, and they usually are very restless, irritable, and typically their symptoms are aggravated at the night. We know from midnight to 3 a.m. Here's the potence we normally use it. Do not forget to know how to prescribing, to observe the vitality of our patient, please. Keynotes of arsenicum. It's easy to give arsenicum. But we must repertorize and see. One of the keynotes of arsenic patient is that they are extremely killy, and that killiness is deep. You can put a warm sweater on them, yet they are still chilly. They are chilly to the bone, and they suffer often from burning pains. Arsenic is for the burning pains. Feel better with heat. This is a very unusual symptom. So when you find people with burning pains that feel better when you put heat on the affected part, that is a keynote for arsenic valve. Let me tell you something. We do this is another thing in endodontic treatment. When we do an endodontic treatment, and we must see if it is a live pulp canal or a necrosis pulp canal. Is alive or necrosis pulp, to give the remedies. So, we put the water, a hot water. If the patient is still very nice, it's okay, is alive. But if not, he is going to be like me. Oh, it's burning. No, is one test we do in our office, in dentistry office. Oral signs: high salivary acidity, the case, gingival hyperplasia, sores, ulcers, and gingivitis with high edema, ache while brushing teeth. You are brushing teeth, and you are aching. Homeopathic remedies in periodontal disease again. Our mercurius is one of the more important remedies in periodontal disease. In the Materia Medica, we can find the classical signs and symptoms of periodontal disease. Gums sponged, recede and bleed easily, teeth loose, feel tender and elongated, yellow tongue, flabby, teeth indented here around the tongue, fetid odor from the mouth, salivations greatly increased, blood and viscidity. The potents use it. We can see the similarity between the signs and symptoms of mercury's toxicity and the periodontal disease. Okay, so now is me. It raised the question: if mercury exposure could provoke all the signs and symptoms of periodontal disease, what impact is the mercury escaping from amalgam fillings having on the incidence and progression of the periodontal disease? This is to you, everybody, to reflect, to think about it. You see, mercurio and the fillings here, amalgam fillings here. It's not only in the mouth, but in all body, in the joints. Think about it. Another remedy, very good, creosotum, disquiet, gingivitis with abundant bleeding, gums sponge and with the sensibility increased, gums with blue-red color, blue red color. It's not red, it's blue-red color, Venus. Dark secretions, cavities and dark calculus, fetid breath, intolerable burning aches. Potencies 5 and 12. This is very important. Staphysagra. For those of who do surgery, such as periodontal surgery, uncovering impacted wisdom teeth and apsectomies, any kind of an incision want. Here is Staphysagra is the remedy par excellence. This managed pen improperly indicate. I use it too much. Mental symptoms of Staphysagra. Emotion upset with partial suppression. Unmarried and oversensitive who expresses his feelings violently. Indignity. The word is with a lot of Staphysagra. And grief. Oral symptoms. Much cavities and teeth loose. Gingival bleeding. High index of important bone loose. Tuya is the remedy for corpulent people. The face is oil and shining. The nose, eyelids carry numerous varicosities. The nasolabial fold is accentuated. The hands are cold and stick. Preoccupied, anxious, and restless, tendency becomes stronger, turning into an obsession with futile and ridiculous things. Tuya have a badly oral hygiene, excessive and sudden gums bleeding, hyperplasic gums, changeable ulcers, painful and red. It's not, do not have blue here. Eh? Painful and red gums, local gingival abscess, uncontrolled bone loose. You see, you must repertorize the patients, stay with the patients to see if it's going to be tuya, creosotum, or something other, someone other remedy. I'm putting here the most important. This calendula officinalis. Oh, everybody knows. Oh, I do not pass it out my calendula in my office. Never in my life. Mirística, Segisbeca, calendula, echinacea, they are together with me. They are in my office. I cannot live without them. And I put malva also, mirística also. So we prescribe calendula after deep scraping at the moment, at exudate regions infected of pathogenic microorganisms. It will going to improve the tissue cicatrization. Important hemostatic and analgesic remedy. It is also used like a check-in. Is that I do? I see what I'm doing. I'm seeing the patient so close of me. With all the things that I am doing. I make like a check-in, complement of a surgical procedure. And see here, 3CH to be an homeopathic remedy must be diluted and dynamized. It's not CM, it's not mother tincture. You make in 3CH or you want DH. I have normally in my office 1DH to 3DH because it's more is more near have more substance local to after deep scraping or a periodontal surgery. Equinácea angustifolia. Oh my God. Opa. Oh, sorry. What happened here? Scraping preventive remedy, always when we find a chronic terrain with mucopus exudation that can cause an acute process. Gangrena, necrosia, preventive remedy. A necrosis tissue with mucopus exudation, fetid breath, and general infection of pathogenic microorganisms. It is also used like checking complement prescribed after scraping procedure. And regards from Brazil. Thank you. Vielen Dank. Muchas gracias. Bolshoi spasibo.
Oh, wonderful, Gloria.
If I have the other link, I want Dora, my Bulgaria, Romania,
Gloria.
everybody. Yes.
You're perfect. You're perfect in time. But we have some little questions. May I ask you?
Yes.
Because somebody came back to the babies and asked them, so for babies, you mainly use the calcarea carbonica, phosphorica, fluorica, and phosphorus. Is that true or was a question?
Now, it's to answer now, I will answer. Let there's something here that's not good. Just a minute. Leave, stop share. Okay. Let me tell you something. I said that you must observe the mother, and I don't know, sometimes the father don't want to go to, no, I will not go, I don't believe in homeopathy, or something like that. But the mother, if you can, if it is your patient yet, your mother and he is pregnant, and you see that the mother have a lot of problems, oral signs that you can treat and prevent the children with the calcaria. I am giving you an example. Is an example, is a history I'm making now, but some is the normal that appears. And if you see, and the mother is have a lot of cavities, have the ligaments are so a lot of movements, have an ogival arc, superior arc. No, so you see that the mother have some problems that comes with the baby, of course. What you do, what is better to, what we do from the 6th month of pregnancy until the baby borns. We give to the mother the remedies, a remedy in the same potence, because it's the potence we know, a small, don't, please, you must see that have a baby. You must see the vitality of the mother. You must see everything. You are homeopath. You must see everything. So you must care about this. You give the once a week, depends of the mother, the problems that the signs, the oral signs that have the mother, that is your patient. You give the mother to prevent the problems, to prevent the same problems that the mother have. The calcarea may be, if it is calcarea fluorica, if it is the calcarea carbonica. If go the mother and the father, and the father is not a fluoric, is a carbonic, you must see the both. You give the both, the calcária carbônica and the calcária fluórica. Or you give each one, mother have more predominance of fluoric. The father is a carbonic like a sulfur, normal. So you go to the problem, to the prevalence of the mother that's fluoric. This is going to I said that you do it with experience, with a time of experience no problem is going to happen. You can give to the mother is fluoric, I can give you her any remedy, calcária fluórica, what we give to the mother. If she is phosphorica, I will give the phosphorica. I give to the mother and she's pregnant. I can give to the mother without she's pregnant too, because she is this constitution, you know? And I am doing that we can have the prevention in the beginning of the structure, is making the structure of the tooth in the baby. 6 months of pregnancy is beginning, the baby is beginning to have the structure of the tooth. So beginning the prevention inside the mother, to the mother and to the baby. And this we are doing for a long time, for a long time. I have 32 years as homeopath, and we are beginning to do this when I created the homeopathy in dentistry in Hahnemann Institute. They begin to work. We have ambulatory, we have hospital, and begin to work to have the provings and to have the returns of this. And was very, 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 very good. Is that why I am showing to you, because I know that you can do it. So simple. It's nothing very impossible. Simple. And we will have good results. I can say it.
And it's wonderful, and it's good the way you do it, constitutional. May I ask you some more questions that have arisen? So somebody asked whether you use Hekla lava in your office.
Hekla lava is wonderful. Hekla lava is very, 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 very good. Very, very good. Is one of the homeopathic dentistry remedies with the bruxism. I must tell about a lot of things. We have the brickism, we have the bruxism, we have the problems of the ATM, the DTM jaws. I have a lot to talk. We are going to stay until the Congress in Spain.
We need a new seminar for this. Okay, so for Brussels.
But it's wonderful, wonderful. Who asked me can use it, please, in DTM, in the ache, is marvelous, marvelous. Take care, the potency. Always looking for the potency.
So in this case, a low potency, or what do you mean?
Claudia, when we have local and general signs, we must use the potency for local and then, or in general, if possible. If you have only local, I use homeopathy. I will not use another remedy, a conventional remedy. If you have the local and a general signs in this patient, let's go to use the general, you know? We must take out the problem, the acute problem first. Then we have time with our patient to go to the, sometimes when have a surgery in the preoperative prescribing, I give the episodic remedy of that patient. I stay with the patient, I hear the patient, I make a repertorization, I go to the episodic, that moment, remedy, because we have no time. We have to make
We need
the,
another for that.
yes.
But
So-
few more questions. This thing I think I can answer. It's of a German. What CH means. This is the C potency, and the H is for Hahnemann. But it's like C potency in Germany. I think this is okay when I say that. Huh?
I didn't understand. Where is
Yeah,
this?
because you call the potencies CH.
See,
In Germany, they are only called C potency. So it's
it's the same. This C, the German have only D or C? D.
both. No, you can have both. It's both is possible. D was in former times, many people used low and D potency. Today there are quite a lot of using also C, but it's not the Hahnemann. It is Hahnemann,
It's
but
the Hering. It's the Hering potence. Is that D?
Okay.
No?
I
Yes.
think like in Germany and in Austria, it's called
No,
only
but to use
potency. But it's
you-
a sentence. It's also with 100 dilution.
Oh, Claudia,
it's-
let me tell you something.
Yeah.
For Germany or for any place. If you have in D scala, Hering scala, decimal, is a decimal scale, or if you have the centesimal scale, what happened here? Here we have too much more dilutions, and here less, the D. So you must give the potence. You're comparing, I put in CH, no? So you put in D, which more D, and the potence higher to be like the CH. I don't know if all the Europe is D, is only Germany. I don't know.
There are D and there are also C potencies. But
Yes,
there were times when they used more D, but today they use C. But as far as I know, what we have in C potencies in Germany and Austria is the same like the CH. And that was the question, what this H means. But it's not a specification, it's like
no,
C.
DH is decimal of Hering. CH is centesimal of Hahnemann. In Brazil, we put the H.
Yeah.
In Brazil, we put the H because it's the decimal of Hering, and CH is the centesimal of Hahnemann. We can put also only C, or only D, or only X, like this, But I normally use the name of Hering, the name of Hahnemann, CH and CDH.
Okay. Yeah.
But no, nothing very important. It's all we know. We do every time in our offices. It's the same.
So then there was a question what cheating means. What do you mean by
Chicken. Let me tell you. If I don't have here, you put some 3 drops more. I put, depends of myristica. You have an abscess. I have a drain of, I drained an abscess in the mouth. So I put myristica and calendula or echinacea have necrosis. I see what it happens in malva to be more quiet, the gum. So I put in 2 fingers of water without any other things, without fluor, without nothing. I put there and chicken. And give to the patient chicken in the mouth with care. with care, because if I had a surgery, he cannot checking like this, checking or leave checking. Bochechar, we call in Portuguese.
Okay.
and then drop it, put out, and is that I give. Sometimes I give these to the patient before sometimes now, normally, before a surgery. The patient stay with the substance that I make in my office and I give to the patient. He stay with that. Is better than other antiseptic, chlorhexidine. What you think about it is fantastic, you know? And he's going to do the same at home, because I sent to the pharmacy a prescribing with a checking of the substance I need to this patient. The patient goes with the remedies, with the checking, with everything, and comes and don't leave me. You know, now I have the children, everybody is with me. They stay with homeopathic dentist, homeopathic doctor. They are some very special God sons and daughters.
So what I can understand, because there were some Russian questions, maybe we have to ask to Vera. One question is, well, it's a bit like what you explained already. Do you use the DH potency? Because the question is why you use 1 DH or 3 CH or 3 CH or 6 DH? Why choose CH?
I understand now. I understand now. Let's speak again. I had said it yet. If you have a local sign, local, here in the point of my finger, local sign, I will prescribe in local potencies. And the local potence is still 6 CH, more or less. 1, 2, 3. Normally it's 4 to 6. 3, 4 to 6. Sometimes have 3 CH. If you is local, but is better with warm when in the morning do not ache, but during the night is aching. It's general. So I'm going to up the potency. And the potency is median. It's not local. So 12, 15 is the middle for general symptoms, for general symptoms. Is that why? Episodic remedies in dentistry, normally you use 30 CH, centesimal of Hahnemann. And sometimes I'm going to another lesson. Sometimes when we are doing with nosódios, do you like nosódios? Everybody knows about nosódios. It's something fantastic. In Brazil, we use them. So we use D, the decimal. We don't use C. For nosódios, pyrogenium is another for periodontal disease. Have a lot. Pyrogenium you can use in 30 DH or D, you know, and is very, have a lot. I stay with you. Have a lot of things. Dentistry have 29 specialties. So I put homeopathy in the 29 specialty in dentistry. You know, so we have it.
Okay, let me see whether there's one more question. I think this was a good answer. Somebody asked what you recommend for TMG. TMG.
What is it?
Yeah, I also don't know. I was wondering whether it's a special.
Oh, TMG pain. Oh, yeah.
Pain. TMG pain. Sorry. Yeah.
DTM pain. Okay, the joint. What I recommend, Eclalava is one of the best.
Oh, really?
One of
Okay,
the
temporal
best.
mandible joint pain.
And
Yeah.
another who I don't know who is asking, but chamomilla 30 CH is wonderful for also the TMG joint. It's very, very, very good. Is that? I give
If
you.
it's a chamomilla type, probably, yeah? If
Pardon?
there's a chamomilla reaction, no? If it's angry.
Yes, of course, of course.
Okay, I think this is a very good answer. And now let me see. Interesting. Somebody asked whether there is a remedy or remedies for large stones on the teeth.
No. What are the remedies for large stones? I don't know. Let me say, Haja. It's not Haja. Is I don't know in Russian here, but the stones. What happened with why we have the stones in the mouth? We have the stones. You know, a boat stay quiet in the water waiting for going to the sea, but he stayed there in the beach and have some big stones here, and the waves come. The waves, the sea have minerals, and the minerals come to the boat. A lot of scraping in the boats and in the stones that are fixed in the sea. Comes, and you can see when you dive, when you go to the beach, the stone with a lot of stones, and the boat also with the stones. If you don't took out the stones of the boat, scalping the stones of the boats, they are going to make a hole in the boat, and you cannot use the boat anymore. So it's the same here. We are the teeth fixed, and the saliva going with a lot of minerals that can go here and go here, and have the gravity. If I put a stone here, he stay here, and downstairs in the inferior arcade have a lot of stones. Is that why you have the stones? And what if you don't brush the teeth? It's going to be the stone with the meals, with the what we eat every day, the bread and so on. So the stones stay fatted, because it's like you put in the warm a meal and leave in the warm the meal, and the meal is going not to be good. It's the same here. Is that fatted breath and something like that? You must take out the stones, and you do it accompanied before, during, and after with our homeopathic remedy. But you must scrape into the stones. You must do it.
And
Is that why everybody has stones, but you must brush the teeth anytime.
I think the question is what kind of constitution it is if the stones grow very quickly.
Which kind of the calcareous carbonicas have the best. The constitution carbónica have more stones.
Okay, so calcárea
Yes.
carbonica. This is, I
You
think,
can see the
yeah.
calcárea carbónica. You know what we find persons calcárea carbónica. We have in the Península Ibérica in Europe, Portugal and Spain. You see that all the Portugal and Spain, the houses are made of stones of calcárea. And they normally, they have, if you see, they have the carbonic constitution. Is one thing is together with the other. One thing is always is together with the other. Nothing is like this. One thing comes together. And they are carbonic. The most population are carbonic. You can see it. It's different from Germany. It's different from ASEAN, from Africa. From Brazil, I don't know, because Brazil have all the world in Brazil. You have all the people that descend from France. I descend from Germany, from Bessarabia, from Bessarabia, and from Portugal and Belgium, Gloria. I am a Brazilian, and my parents comes from all of these countries. And Poland, I forgot Poland. Boniszka Poland. So Brazil have a mixed of a lot of people. They love Brazil. Everybody comes here. That is, but in Portugal and Spain, mainly in Portugal, we have calcárea carbónicas. Quite all the population are calcárea carbónica. They have very stones.
Okay, I think this was a very good answer, yeah. And then I see, actually I see no more questions. Oh yeah, I don't know the Russian. Vera, maybe you can tell Gloria whether these are questions. There, I see some question marks. Is there any Russian question that needs to be translated? Vera, can you please tell us?
Where is Tatiana? I'm not seeing Tatiana.
Tatiana.
Oh, it's coming. No.
Well,
Yeah.
I don't hear her saying anything, but maybe she's. Did you talk with Vera about the Russian questions? Now there are two more questions. No more. It's not a question, just information. Okay. Okay. It's already answered in Russian. Okay. Well, then I think there is no more question, but there is a lot of. Thank you very much for sharing this nice information with us, Feighelstein. Thank you very much for kind information. Hope to see you in Spain.
Let me answer one question here. I'm sorry. It's from Raja. Raja Khan is asking. I suppose that is he. For information, magnesia phosphorica is also very useful in dental pain. Yes, Raja. Yes. It's very good, dear. It's very good. Florina, congratulations for France.
Yes.
Oh, so beautiful.
Thank you very much, Gloria. She also
thank you.
very clear when you must your high experience, and we really appreciate, Florina said, and I also say, yeah. And then thank you very much, Gloria, by somebody in Russian I cannot read. So Raj also said, thank you, Gloria, very much. So that's very much thank you. And me also, I want to say thank you very much. This was very informative and very well explained how to look into the mouth to know or to see something about Constitution. I think this can be helpful if you have a picture of a person and you look into the mouth and you say, this fits into my idea of Constitution of this person.
Claudia, I remember you when you arrive in the Liga Congress, and when I begin to speak about Constitution, you are very interested. Like this, I want to know more and more. I did it with love, a special love.
That's very good.
I do not forget. I do not. So many years ago, you arrived and wow, it's very good. I
Yeah,
want to
because
know
you see,
more.
we learn so many symptoms for constitution, but few homeopaths, I think, at least in Austria, really look at the teeth. Maybe they look at the tongue, but the teeth normally not so much. So this is really something special and very, very interesting. And I'm so sorry, once again, that in Austria we don't have dentists working with homeopathy. So we have to support them.
I am here. I will do
Yeah.
all my best. I hope that God give me more years. I am going to,
Yes, we hope so too. And Gloria,
yes, to give you all my best.
you asked, or you said, or I asked you, you said there is more information you could give. You would do a second webinar. Did I get it right? Yes, you would. So this is
Yes,
really
okay.
very, very kind of you, very kind of you. And we'll come back to you.
Okay.
So
Thank you.
thank you very, very much.
Thank
And
you, Gloria, and thank you, Vera, so much.
thank you very much. And looking very much forward to seeing you and seeing all of our guests today in Sevilla. So see you in Sevilla, like the Spain also. Nos
See you in
vemos.
Sevilla. See you in
Nos
Sevilla.
vemos en Sevilla.
Yeah. Vamos,
Okay.
Sevilla, Sevilla. See you, Sevilla.
bye-bye,
Ciao.
bye-bye.
Bye-bye.
Bye.
I think, Evin, you have to